I have the pleasure of introducing our roundtable participants today. But before I do that, I just kind of wanted to talk a little bit about this roundtable. So last week we had an overview of syringe service programs that kind of went over some of the services that they provide, some of the research that supports supports syringe service programs. And then today, what we're trying to do is see how how those syringe service programs work in different counties. So we have 6 participants today, and I'm very excited to introduce them. So Amy Ines is an EIS peer prevention specialist for the University of Kentucky's Target 4 program in Boyle County. She is a graduate of Eastern Kentucky University College of Nursing. Amy is an adult peer support specialist and person in long-term recovery. She was the prevention specialist for the Healing Community Study in Boyle County prior to her current role within the Boyle County Health Department. Amy uses her lived experience alongside continuing education to provide harm reduction services to people who use drugs in her community. Jennifer Gully is a nurse administrator at the Clark County Health Department in Winchester, Kentucky. Jennifer received her Bachelor of Science in Nursing degree from Morehead State University in 1992 and a Master of Public Health degree from Eastern Kentucky University in 2019. Jennifer serves as the coordinator of community health improvement planning, as well as the department's harm reduction syringe services program. Lauren Kathman is the programs manager of the harm reduction programs with the Northern Kentucky Health Department in Florence, Kentucky. Mrs. Kathman earned her master's degree in executive leadership and organizational change through the Haley College of Business at the Northern Kentucky University. She served over 13 years as a child life specialist at Cincinnati's Children's Hospital Medical Center before joining the Northern Kentucky Health Department in 2020. Mrs. Kathman oversees the NKY Health Syringe Access Exchange Program operations, as well as the Hep C and HIV prevention and testing and naloxone distribution. Casey Mace is the infectious disease nurse at the harm reduction coordinator for the Greenup County Health Department. She is a graduate of Morehead State University and Ashland Community and Technical College. Mrs. Mace has been employed at the health department for 21 years and oversees the harm reduction program since 2018. Lauren Passmore is the interim community health manager of the harm reduction outreach services in the public health and wellness department at Louisville Metro government. She has been working in Kentucky for the past year after receiving her permanent residency, hailing originally from Canada. Living in the Northern Territory of Yukon, Lauren has worked for the past 15 years in harm reduction, HIV, Hep C, public education, mental wellness, and maternal health, predominantly for and with Indigenous government and communities. Lauren brings this expertise to programs and services delivered through HROS and is constantly learning more about the Jefferson County community. Rebecca Smith is the health education coordinator with the Kentucky Income and Reinvestment Program, Target 4 program at the University of Kentucky. She works specifically in Jessamine County Health Department to assist in the syringe exchange program, HIV/HCV testing and counseling, as well as the outreach and education. Rebecca earned her Master's of Public Health from Eastern Kentucky University. Prior to working in harm reduction, she worked as a certified prevention specialist focusing on substance use and suicide prevention at Four Rivers Behavioral Health. So thank you to our speakers, or to our roundtable participants, and I'm going to turn it over to Jennifer Gully. I think Jennifer Gully's screen might be frozen, so I'm going to go ahead and go over the speakers do not have any relevant financial relationships to disclose during the past 24 months. The learning objectives for today. The last week, we did a broad overview describing the evolving opioid and HIV and hepatitis C epidemics. We described key principles of harm reduction and the role of syringe services programs in reaching a highly vulnerable population. And if anyone would like to watch that overview, it can be found on our YouTube channel, and I will put the link in the chat shortly. And then today we're going to explain the successes, challenges, and lessons learned from harm reduction syringe services programs in 6 Kentucky communities. I am going to skip over the Clark County SSP for now, and we will go to the Boyle County SSP.
Hello, everyone. I knew that was going to happen the minute you said Jennifer's screen was frozen, John. I knew that was how that was going to play out. So I am Amy Annis, the EIS Peer Prevention Specialist here at the Boyle County Health Department. I work for the University of Kentucky's Target 4 program. Here's just some pictures. I really wanted to display and let you guys see some of the items that we're able to give to participants as they participate in our program. I think it's really important to note our population of our county is about 30,000 and about 125 visits per month. Like if you think about that, that's a pretty big volume for such a small community. This is a relatively new role for me. I started in June of 2022. I absolutely love it. We serve a large population of people. We are here and operational at the Syringe Service Program anytime that the health department is open. And so we launched in 2017. We'll be going mobile here within the next couple of weeks, which is going to be amazing so that we can reach some of those harder to reach individuals who lack transportation and have some barriers getting to us at the actual physical site here. And so we're pretty central to Kentucky, as you can see on the map there. And syringe service programs, I think it's also really important for people to understand, like it's not just the exchange of needles and syringes. It's so much more. I mean, not just the physical things that you see in these pictures, but the interactions that we have with these participants, which we'll discuss as we get into the successes and barriers and stuff. So that's me. That's who I am. And I love what I do, and I'll pass it off to the next person.
Thank you. Next, we're going to talk about the Greenup County SSP.
Good morning. I'm Cassie Mace with the Greenup County Health Department. We launched our syringe exchange in 2017, and it was 1 day a week. And as time has went on, we have grown it to where we have our fixed facility site. It's 2 days a week, Wednesday and Thursday from 1 to 4. And then in 2021, we began a mobile exchange and outreach program. We offer HIV, Hep C testing and treatment navigation with a partnership with UK's for Health. We also always have peer support available at our syringe exchange. We provide Narcan and fentanyl test strips to all participants. Our population, and it's kind of, as you can see in the map where we're located, even though Greenup County has a population of a little under 36,000 people, where we're located bordering Ohio and West Virginia, we get folks from those counties as well that comes over to us. And we average anywhere between 20 and 30 people a week. We have gotten up to 47 in 1 day. Or pardon me, it's 20 to 30 people each day. So we're getting between 40 and 60 visits a week to our syringe exchange, and we have a little under 300 unique individuals in our program.
Great, thank you so much. Let's see, Jennifer, are you able to come off mute? Next, we're going to talk about Jessamine County SSP.
Hi, everyone. Like you mentioned earlier, my name is Rebecca Smith. I work out of Jessamine County Syringe Exchange in Nicholasville, Kentucky. We are located right outside of Lexington. We see a lot of people from surrounding counties as well, such as Garrett, Frankfort, and just different areas. I believe we were the 4th SSP in the state. We launched in 2016. I know when they first started, they were only open Mondays. Now we're open every day of the week. We have a late hours. On Monday, we're open to 6:30, and then we do close earlier on Fridays. My favorite thing about our SSP is that participants walk through the front door just like anyone else accessing services from the health department. They have their own waiting area with a doorbell that lets us know when they're here. And usually the first interaction we try really hard is to be with a peer support specialist. We rely on our collaborations with community partners such as Isaiah House, our New Vista Quick Response Team, and Shepherd's House. Their peers volunteer with us in our syringe exchange, so we really try to keep that first interaction with them, because I do know, they provide, their lived experience provides a lot of that support. We have, like I said, we're at the health department every day, but we're also on mobile site locations. We try to do anywhere from 2 to 3 days a week out of the health department. Every Monday, we go to an underserved area called Tate's Creek. It's a mobile home park area. And then on Thursdays, we set up at Sparrow Health. It's a new medication-assisted treatment center here in Nicholasville. And both of those are hotspot areas. We try to really emphasize where our mobile unit goes based on those overdose rates that we receive from Nicholasville Police Department. Last year, we had around 3,700 total visits to our syringe exchange, and 768 unique individuals visited us. We average about 70 visits per week, and we receive a lot of support from our ASAP coalition. We're able to supply participants with fentanyl test strips, tourniquets, sterile water, cookers, syringes. We do 2 different types of syringes. We have longs and shorts. Participants are our best source of information. I really value their input, and we have surveys at the health department that they can fill out to kind of help me know what supplies they need or other, things they may need to help them with their health. That first picture up top, that's just a representation of a lot of our volunteers that we work with in the syringe exchange and harm reduction. Couldn't do it without them. So, thank you.
Great, thank you. All right, and then let's talk about Jefferson County.
Hi there, my name is Lauren Passmore, and I'm the interim community health manager here in Harm Reduction Outreach Services. So I'm going to move around the slide a little bit, just start with our population. So within Louisville itself, we're about 750,000 people. And then within Kentuckiana, because we also see folks coming over from Indiana to access our services, we're at about 1.3 million. We were the first SSP to open in Kentucky, and that was in June of 2015. It initially started here at 400 East Gray Street, but it was in the parking lot of the headquarters versus inside the building, but moved indoors, and I'm in our actual space here right now. We have expanded to 2 brick and mortar locations, again here at 400 East Gray Street, and then we have a 1229 Shelby Street location, which is about 1.5 miles from here. And then we've partnered with the Kentucky Harm Reduction Coalition as well as UK Target 4 to operate 8 mobile sites across the county. We provide syringes and safe disposal, safer injection education, HIV, hepatitis C testing. We have a wound care nurse that works with us 4 days a week between our fixed sites, so here at Gray Street and over at Shelby Street. We do overdose prevention training and naloxone referrals to medical, social, behavioral health resources. And then we also partner with the quick response team. Our hours of operation here at 400 East Gray Street, we're here Monday, Wednesdays, and Fridays. And so we have 11 to 4 on the Monday and the Friday, and then 1 to 6 on Wednesdays. And then over at our other location on Tuesdays and Thursdays, 11 till 4. And then our mobile sites are open 6 days a week, 6 days a week at various times. And so our stats with respect to unique participants, we between January of 2021 and March of this year have seen 9,683 unique participants, totaling 68,410 visits, and that roughly is about 444 visits per week.
Hi, I'm Lauren Kathman. I'm our Harm Reduction Programs Manager for the Northern Kentucky Health Department. And we began our first syringe exchange in March of 2016 in Grant County, Kentucky. And we are an independent health district, so we cover 4 counties, Boone, Campbell, Grant, and Kenton counties. And we operate a syringe exchange site in 3 of those counties, in Campbell, Grant, and Kenton. And we have 1 set day for each week that we operate at each of those locations, and the same hours for each of those locations are from 1 p.m. to 4 p.m. And we have been given city and county resolutions to operate in each of those locations. So sometimes it looks a little bit different at each location. But at all of our locations, we're able to offer Hep C and HIV testing and connection with our Hep C case management for linkage to care. And we really value our partnership with the CURP Target 4 team, that they are helping us with our programs for syringe exchange, especially our testing, and they're able to provide incentives for that we're doing. And then in addition to that, they do a separate outreach of testing events throughout the month at various other locations, but the syringe locations that are set are the only ones that we're able to operate out of. And then we do naloxone distribution, wound care assessment, and then we have a peer support specialist on site, and we also have condom distribution. And as well, we just started yesterday distributing our fentanyl test strips. So we're excited to have those as well. You can see some of our numbers here that from our fiscal year last year, we had a total of just over 4,500 visits with 1,500, almost 1,600 participants. And then you can see our naloxone kits that we distributed was just over 3,500. And we have additional programs that we do with our harm reduction separate from this, but this is just what we have at the syringe exchange.
Great, thank you so much. All right, we are going to move on to the roundtable portion of this session. And so we have kind of 4 areas that we're going to look at and kind of get different perspectives. So from the presentation slides that we just saw, you can see that, sorry, I'm reading messages. You can see that we have different locations that are serving, different sizes, populations, and there's just a lot of different things going on. And so what we're trying to do with the roundtable is just to see how those different perspectives and those different locations and those different volumes can impact the valuable work that SSPs do. So let's go ahead and get the discussion started. So we're going to start with some of the successes that are, sorry, I'm scrolling through a document. Here we go. Yeah, so what are 1 to 2 successes of your syringe service program? And we are going to start with Rebecca at Jessamine County.
One success that I really like to mention is our mobile unit. We got a grant for that in 2020, and it's been going out ever since. I do know even throughout COVID, they made sure that mobile. Can y'all hear me?
Rebecca, it seems like we're having some technical difficulties. You could try turning off your video, and maybe that will help.
Can you hear me now?
We can.
Okay, we've had some internet issues since the wind damage. Anyways, our mobile unit, we're able to take it out and meet people in rural areas that typically don't receive any kind of connection to Nicholasville. One area is Tate's Creek. It's very rural. Transportation doesn't go out there. We've been told countless times that they would not have any access to Narcan, even clean injection supplies, any of that if it weren't for us coming out there once a week. We've developed really good relationships with them. And now we've brought other community partners with us, such as Brightview and Shepherd's House Recovery Community Center. And they go out there and do like food donations, clothing donations, and really try to help people. With our mobile unit, we're able to provide anything that we do in the health department. But, in our mobile unit, I've taken the nurse out with me to give COVID and flu vaccines. I do hepatitis C testing, linkage to care, as well as HIV testing. And with that hepatitis C testing, I'm able to link them to the Bluegrass Community Care Center here. And then they're able to get them, treated for Hep C. And they have funding to offer them transportation or vouchers for that. So just, linking them to community partners that are able to provide more than we can has been really beneficial. And I know I said 3 on that first slide, but I just secured 2 more sites that I've gotten permission for the mobile unit. So I'm always trying to progress that program and get out to wherever we can. So that's my success here in Jessamine County.
Great, thank you so much. Next, we're going to hear from Amy in Boyle County.
As I mentioned before, guys, I didn't start this role until June of last year. And consistently what I've noticed since that time, not to toot my own horn, but toot, we have exponentially grown here in our program. So on average, it's about 125 participants that I see a month. And while that doesn't seem like a whole lot when you compare it to, like, the Louisville metro area, but for one individual that not only provides that syringe service access, but the hepatitis C testing, the HIV testing and outreach as well, like that's a lot of people. And I feel like the success is in the fact that I do believe that my lived experience has helped me to form these relationships with participants and allowing me to truly meet them where they are and to hear from them what's going to work best for them. What am I able to provide for them that makes this program all about them and unique for each individual? And so we're able to do that in a whole lot of capacities based on supplies and from feedback that we get from individuals. So that's been a huge thing for me. Like, I've loved to watch that. I've loved to see it, the growth in the program. And then also the Boyle SSP absolutely has been a huge part of OEND here in Boyle County. And a lot of that came from my previous experience as the prevention specialist with HEAL and Narcan and understanding the importance of having that in the community. But outside of being able to distribute that to the individuals, participants, and we have 3 different formulations of naloxone now, which I'm sure you guys are all aware, but being able to taper which one is best based on needs of clients, as well as still partnering with other agencies as we provide testing outreach, we can also offer that overdose education and naloxone distribution. And so we know that that is being seen in our community, as reports back from the QRT that they are now showing up on calls. Naloxone has been administered, when they get there, which is amazing. And so I did a training at Boyle County schools for their staff, and they actually used a unit at a state ball game and revived a gentleman who ended up in treatment. And so when you hear stories like that and those huge successes, it's just wonderful to hear. And you know that the work that we're doing is truly like saving lives in our community in one capacity or another.
Great, thank you so much for sharing. I also wanted to give any of our other roundtable participants time to share any successes that they would like if they wouldn't want to. Lauren?
I think it's just very clear that people are building really wonderful, trusting relationships with folks, and that's the foundation of everything. So creating spaces that people feel welcome in and safe in and reflected in, and providing the staff and the support to build trusting, respectful relationships with people, and that trust is huge. And so I hear that in both the examples that were given in these successes, and I just wanted to shout it out because it's the foundation of everything, making people feel heard and seen and safe.
Great, thank you for that. All right, we are gonna move on to our next topic. And so what are some of the challenges with your program? So let's see here. Lauren Passmore, you were able to talk about some of your successes, but I was also wanting to hear about some of the challenges that you face at your SSP.
Sure. I've been in this position now for a year. And in that year, staffing has been a huge concern and issue for us and challenge. So we had some high turnover and then some time with just not enough numbers to feel like we were keeping the ship going. But that's been, creating the space and the time to put out the posts and do the hiring and go through the HR process and bring people on board and keep all the other programmatic pieces running has been challenging over the last year. Also, I think because of that, our outreach program has dwindled a little bit, and we're again moving back up towards being able to do more outreach, which is needed. There's lots of areas, as I said, we cover with our mobile sites, but there's areas that we aren't, and so having boots on the ground to do outreach work has been a challenge for us over the last year. and an area that now we're able to kind of get back into, which is exciting. And then, post-COVID, so I arrived here in the States during the pandemic, and then started working in February of 2022. And hearing about all the changes that had happened within the public health department during COVID, and our program was able to run consistently throughout that time. We were at the front doors, so we weren't in our in-house location, but staff were able to keep it going. But there were other aspects of our program that we weren't able to do, those community partnerships, those events, those fairs. And so building those programs back up is something that we're paying a lot of attention to now, and is a bit of a challenge, but that's okay. But those are some of the pieces of our puzzle. Mm-hmm.
Great, thank you.
Yeah.
Rebecca, I think you also had something that you wanted to share on this topic.
Yes. One challenge that we encounter, like everyone else, I'm sure, is not having our community's full support and, of course, stigma. We have 2 case managers on our harm reduction team as well. So we see a lot of clients experiencing mental illness and, sometimes suicidal ideation. And when our participants, when we try to link them to care or access to emergency services for their mental health, their needs aren't being met. They face multiple barriers like transportation or not having an ID. The funding that we currently have doesn't fund any sort of identification. So when we're able to link them, and then sometimes those services fail that participant, how do we recover from that? How can we get them the help that they need while staying in our lane and under our, funding sources? So we've tried working with our local emergency room, for example, and it's just not being met well. They either, lack the communication, or we try to go around them to other resources within the hospital. And it's just, we keep getting, different roadblocks. So just trying to give participants hope, and that, not to lose that hope and to keep trying. We'll try different resources, but yeah, that's one challenge that we've seen, especially since after COVID. We've seen a lot more participants with mental health and trauma needing work through that. So that's one challenge that we have here.
Thank you. So you mentioned not having your community's full support. So I was wondering if you or any of the other panelists wanted to talk about some of the things that you do to kind of work on that. So how do you gain a community support or help reduce stigma?
So I will share this. In Jessamine County, the previous harm reduction supervisor, Bruce Crouch, worked for Nicholasville Police Department for many years. Had a good relationship within the county. But when I first started in July of 2021, he was like, good luck on getting into Wilmore. We don't serve anyone there in person with our mobile unit. They don't carry Narcan. Just good luck. But with Sydney, my current supervisor, we've really tried having conversations with local officials. We met with their chief of police several times, and now their police department are finally carrying Narcan, and it's been a huge win. So continually showing up in that community. I do HIV outreach testing. I've tested there at their Dollar General. I've worked with a couple different churches there, trying to promote mobile outreach. I did an overdose training for just the community in general last August. So just keep showing up and, making connections with people you may not know. You may not see as like someone directly working in harm reduction, but they have, so many resources that they can connect you to within that community. So a big win for us in Wilmore was getting them to carry Narcan, when at first they were like probably our number one challenge as far as a community or area to get into.
Right, thank you. Does anybody else want to address that?
I just think the biggest thing Rebecca said is the suiting up and showing up. I believe the more that your face is seen out in the community, no matter what venue it is, like it spreads out collaterally, because when you live in, especially in smaller towns, when people see you consistently, I think that helps. And we have a relatively supportive community all the way around. we have some that probably more so just tolerate us and just don't make us think about it. But for the most part, we're really supportive. We just elected a new sheriff last fall, and I have been able to sit down with him since then, earlier this year, and kind of explain to him what our program is, what it looks like. He was super eager to learn, which I was so thrilled to sit down and talk to him. And I actually showed him the supplies that we're able to hand out to individuals, and all the other resources. And I think I think it's lack of knowledge. And I think a lot of times people don't just know, and they just think that we're out here just exchanging supplies and perpetuating a problem, when indeed that is not at all what we do. And I think a lot of times it starts at home too, like, like educating your family, your close friends around you, because like I said, that word disseminates quickly through our communities, especially when it's this small. So Rebecca's right. Suiting up, showing up, and your face being seen in the community as in a positive light.
Lauren?
Yeah, just to really echo and hold up what Amy and Rebecca have already said around, creative places, creative partnerships, unlikely places, and that consistency piece, exactly that you're not just popping up here and there, but you're not going anywhere. You're going to be there. You're going to have those conversations. You're going to, engage with people. And then, like Amy said, having those one-on-ones. So not only creating the time to deliver your service, but creating the time to have one-on-ones with whether they're formal or informal leaders in the community, they can become allies. So you can, go over the supplies, destigmatize the whole experience, talk to folks one-on-one about what's going on and why you're there. And that just sort of reduces the confrontation of it, just maybe them only seeing you when you're delivering services, but they know that you've got great intention, that you're creating time otherwise to also engage. And then in my experience, connecting with youth and connecting with elders, they have a lot of power in their communities, and they have a voice, and they're often left out. Not always, but often they don't always have a space to speak. So connecting with both youth and youth organizations that might want to take on a cause, and then also elders who have voices and power in their communities too.
Great, thank you so much. Let's see here. I know that Rebecca touched on this a little bit in her answer when she was talking about challenges, but the next topic is about barriers. So I was wondering, Cassie, if you could touch on some of the barriers that you see in GreenUp.
Like what others have said, there's like some stigma and things that we've had to really work on, and it's been an uphill battle here in Greenup County. One thing, and it's like what was been said before, is sitting down, have conversations. If you go one-on-one with people and you're able to share, hopefully we've kind of let them know what's going on and let people just kind of see what we're trying to do. And we've worked hard to raise awareness, share information, and dispel our myths and rumors. One thing that has been really helping us is Greenup County is part of the Wave 2 counties for the Hill community. And we've been working with them, like we're having billboards in our area, listening sessions, and just really working to engage conversation and show that, yes, this does happen in our area. Yes, this is what's going on. This is what we're trying to do to fix it. A big one here that has been devastating in our county was a couple years ago, our hospital closed. And Greenup County is fairly large. And what we have is, almost all of your stuff is down on one part of the county. This is where most of the doctor's offices are. This is where people can get the MOUD is at. Even our health department is down that way. So, and transportation is difficult, money is tight. So we've been trying to work on how can we help get people the care and the resources that they need. One thing that we have done, again, with our mobile unit, we've been going out to these hot spots. We've been delivering resources. You can take vaccinations, you can take Narcan, you can take the fentanyl test strips, we can try to go out that way. We're working on our partnership too with our Pathways area. They have a thing called Pathways to Go, which is this large RV. And we've been working with them to go to places, and they have where you can do telemedicine in it. You can bring the services to them so they can see providers, they can have counseling and not have to drive an hour to an hour and a half to get to where they need to be going. And with our MOUD, working with Heal Again, they are looking to get more MOUD providers in our county. And so just trying, again, get to the people to where they are so that we can keep building this up and, again, lower the barriers for entry on this.
Hey, thank you so much. It looks like we have a question, and it said, I've had clients report going to mobile syringe exchange and having law enforcement drive through. Is this a common barrier? So I was just wondering if anyone wanted to touch on that.
I'll talk on that one. We actually had, when we were doing a mobile, it was last May actually, and we had some people call the police on us, and we had a large law enforcement presence. And that was one that we went directly to law enforcement and had a conversation with what we were doing, what we're planning to do, and shared this information with them. And what you've also, and my thing is, we're not hiding anything. We're there in plain sight. You can come visit us. But after our conversation that we've had, it seems that has died down because, again, I think people just had some assumptions of what was going on, and we were able to say what was the truth.
We've had some similar instances with police in the past in our various locations where some police have driven by, somewhat innocently, but we've had others where we're kind of on like a little bit of a side seat where it seems more deliberate, where we had a police officer come down and park, but you could tell that he was on his laptop, and the staff, only assumed that they were running the plates of the cars that were parked, that were coming to a syringe exchange. And I've worked with our staff to just really be as friendly and approachable as we can, because I know some of the staff get really, it's easy to be angry, and to want to say like, leave our participants alone. But I said, we can't, I said, we have to kill them with kindness and try to work with the police. And so we've had some police officers that have walked up to our exchange and just say, hey, have you ever been here? Like, let us tell you about what we do. And I said, just be very welcoming and help them know, like, we're trying to help you and the public, and we're trying to make sure people have, sharps containers and safe places to throw away syringes so that you're not encountering them on the street, or just kind of giving some positive aspects to help them see how it might be helping their job by the services we're providing, and then letting them know, that we're through like the core naloxone, like we're not allowed to give them naloxone as an officer, but if they as a civilian would like some and they want to carry it. And so we try to find ways to just loop in positive aspects of that to just kind of help build that rapport with them, to let them know. And then we've even had staff kind of deliberately at one of our busier exchanges see the officer and just start talking to them, but kind of like walk them to the side, say, oh, let's get out of the way while they're coming to the table, because knowing participants are just not innately intimidated and not wanting to come up. And so just kind of helping divert the conversation to not like at the table where everyone's walking up, and so people feel more comfortable. But it is, it's hard because you'll have participants who go back to their car or will sit in their car and not come out until the officer is gone. And I know we had some stuff before I was in my role when our syringe exchanges first opened. There was one that was really close where it sat. It still is like near a city line, and that the one city would patrol up and down and watch people pull in and out. And if they went into their city, they would pull them over. And so I know that our health department had to have conversations with them of, like this, we've been given permission. This is where we've been told to operate. Like, that's out of our control, but like, please work with us. And so that eventually stopped. But I definitely think it is all about relationships, and you're going to have turnover and new police officers. And so that's why I told my staff, I was like, just provide education in any way we can, and just be kind. I said, don't I said, do not bring an attitude. I said, it's not going to end up being helpful for us. And I said, just, be as kind as we can. I said, just to, and educate our participants. If you do see police, we're always telling our participants, put everything in your trunk, make sure you get to a safe place. Don't leave this out in your car. Naloxone is not, it's not a probable cause to search your car, but please just keep everything out of sight, get where you're going, and just kind of empowering our participants, because we know they can just gradually be more intimidated by the police in general.
Thanks for sharing that. I know that you also had some other barriers that you wanted to talk about with your SSP.
Yeah, so one of those, I kind of mentioned a little bit earlier. So we're in a district, and so we are operating, we've been given permissions to operate in 3 of our 4 counties to do a syringe exchange. And to get those permissions was not an easy task. They had to come one by one, and lots of lobbying and lots of town hall meetings and things to get them approved. And so we were given resolutions that were made between each city and county location that were voted on by those cities and given approval. And so that's where some of our operations may vary a little bit from location to location. So for example, of our 3 counties that we operate, 2 of those are mobile site units, and 1 of those is in a fixed site in our brick and mortar in our health center in Grant County. The ones in Kenton County and Campbell County, the cities did not, at the time, felt it was more stigmatizing to have in our health center, that it was isolating kind of their city per se. And they thought, oh, if you guys have mobile units, then, more cities will ask you to come and have syringe services in their in their cities. So we were told we had to be in a mobile site, and we were given a parking lot of where we could operate. And that's where we were told we could operate in during the certain hours. And so doing that, yes, we are out in the public. One of the locations, it's not the most ideal. It's not where we would want to be in that city, to be in a more prominent area where our participants would be. But we have to operate within the confines that we've been restricted to. So you have to make the best of what you have with that. With those restrictions also, are kind of that we have the challenges or barriers with that, with the resolution. So one of the locations that we operate is in the parking lot of a Catholic hospital in the area. And because it is a Catholic hospital, we are not allowed to distribute condoms on that site, on that parking lot. And so it's frustrating for us and staff, but I've told our staff, I'm like, let's just focus on everything we can do, and let's participants know other places that they can get these items. So we let people know that they can come in at any of our other sites, any of our community events, or into our health center. And we now have a mailed naloxone program that we're doing, and we can actually mail to anyone in the state of Kentucky, but we were able to set that up through HEAL initially to get that website set up. We're getting ready to expand on our program through our mail program and offering the male external or female internal condoms, as well as on the checklist that people could ask for to receive in the mail program. And when we can mail those out as well. Another kind of barrier we have at one of the locations is it has a very, very strict 1-to-1 exchange rate. And even though we want to exchange and provide based off of need, we are doing that in our other locations, but the one location where we are restricted to that, there have been times that we've had to turn participants away, that we'll have to let them know, if they have syringes that they can return, we usually do off of 10. So if you return 1 syringe or you return 9, we're going to give you a pack of 10. And if if you give 11 back, then you're going to get 20, but you can get up to 40. But at the one location, if you're a returning participant with no syringes, we cannot give you any syringes, and we can give you other supplies. If you are a brand new participant and have never been there, then we can give you 40 syringes, up to 40 for your first time. And so we encourage those people, because we get participants that get really upset about that, and we'll say, hey, come see us on this day at this location, different things. So part of those are barriers, just trying to work as best we can, because we don't want to be told we cannot operate. So it's just, we have to, go within those rules. One of those sites specifically, we're looking to build a new health center in that county. And so we're hoping maybe we could transition in about a year potentially to work on our own site and remove some of those barriers. And another one that we have is because in our district, the resolutions state that we are only allowed to service participants who live in our zip codes. And so we have like a list of zip codes. So where we're at, if anyone's not familiar, we're literally at the top of the state. So we are right on the Ohio River. So we have people who are transient, work and live in Cincinnati, Ohio, and come back and forth, you know, just like some of you guys in Louisville, like you've got people going back and forth across the river. And we're in a tri-state area there with Ohio, Kentucky, and Indiana right here. And so we have participants, you know, and they'll say, oh, like, where do you live? And they're like, oh, you know, or if someone's homeless, you know, basically our staff, you know, can't tell someone, but they're like, oh, which one of these zip codes do you live in? And they're like, oh, here, you live here in Covey. Like if someone's like stuck on what to do, because we don't want to turn anyone away. And so it's hard when you have those kind of restrictions that you're operating out of. But where at the same time, like I said, our mail naloxone, like we can do that anywhere in the state, but at Syringe Exchange, we're limited to that. So that's just kind of, you know, one of those barriers. It's hard at times to, you know, work around. In addition to that, the site where we are on the hospital site, anytime we want to add new supplies or new literature, we have to run it through the higher level leadership at that hospital, and they have to approve what we're adding because it's on their property. So perfect example, we just went live with fentanyl test strips this week at the other two locations, but the one, because Core and KDPH provided literature that comes with that you're supposed to distribute with the fentanyl test strips, that specific hospital did not like the verbiage in that document that they thought we were telling people how to do drugs. So we have been recreating that document. The hospital gave us recommendations. They liked the CDC version better. And so they're willing to compromise. So we're kind of blending those and creating our own branded document from our health department. So we're in the process of developing that. But once that's developed, we still have to send it to them, get their blessings, and then we can begin offering fentanyl test strips at that location too. So it's just, sometimes like you just got to do what you got to do. And like, you know, it's taking time to recreate this document, but at the same time, like it's getting where we're wanting to go. So sometimes, you know, we keep saying, you know, here for us in Northern Kentucky, like the road is always uphill and windy. We get where we're going eventually, but it is not always easy, but it helps you prepare for the next thing. So when you know something's changing in the landscape, you're like, oh, I want to offer this service. Then I just immediately start telling my staff, start researching it, find out what evidence-based articles you can find things, because we as advocates in our roles want to say, we know this is the right thing to do, but that doesn't get approval when it comes to, you know, government and local government. So we kind of have to have more fact space and things to be convincing to get those things. So I've told our staff, I'm like, we just have to bring the utmost respect and professionalism as we prepare these things, and be prepared to be told no, but find out whatever you can find to help someone not say no by find all the answers that they're going to ask, so that you only have to go one time to ask for these things.
Great, thank you so much for that answer. I think, Lauren Passmore, do you have some of the barriers that you wanted to talk about as well?
Wow, Lauren, thank you for sharing all of those, and yeah, all the amazing work you're doing to move through those barriers. That's a lot, but like you said, the optimism will carry you through, and the hard work and dedication that you and your team are putting in, it's awesome. And I was just looking over my notes, and I can really see where I was in the moment that I created this little section, because supplies were an issue for us, a huge barrier not that long ago. I couldn't get any 29s, I couldn't get any waters, trucks weren't coming in. So it's a different set of barriers than have been shared, but they're very practical ones in terms of like just having the supplies to share with participants. And part of that is, you know, the trickle down from COVID and just supply and, you know, people to move things from point A to point B, but we weren't getting in critical supplies for our participants. And so we had to lean on partners, and move things around. Staff were taking supplies from one location to another, just to make sure we had a little bit at each one to provide to folks. And so, yeah, and we had to reach out to other vendors and do some quick orders with Amazon. And so just, you know, sometimes those that scramble. But in particular, in the last couple of weeks, one of the barriers was supplies, and that was really a little bit nerve-wracking and a little bit, scary, because you want to be able to provide everybody with what they need. And we were a bit short on some things. So the other thing I was thinking about too is just, and this has been talked about in different ways, but transportation for folks. So Louisville's got different areas and not a lot of services, and equally spread across the city. And so we have a lot of folks coming in from the south end and the west end where there aren't a lot of services. But transportation is also not an easy thing to come by. So we would like to see more fixed and mobile sites in different areas of the community. And so just to, provide people with what they need where they're at, and for those services to reflect the community that they're in. And so that's just one barrier that we're seeing, is just people are having to really travel quite a distance to get to either our fixed sites or our mobile sites. And so being able to expand our services within LMPHW, but also to partner with our community organizations to support them in expanding as well.
Thank you.
Yeah.
I feel like we have been touching on this throughout the roundtable, but I think it's important to give it its own space. But what we're going to talk about the lessons learned through working and running SSPs. And so, Cassie, I know that you wanted to talk about some of the lessons that you've learned in Greenup County.
All right, found the unmute button. Our big one is, and I've talked to several people, and they always say, your exchange is a little bit different than others. And I'm like, really? They're like, yeah. Well, my big thing is, and this is something we look at, we don't focus just on harm reduction. As we've said, we always try to meet people where they are, and that means you need to look at these folks and you need to see what is it that they're needing. If they're hungry, tired, or stressed, they are not going to hear anything that we have to say regarding treatment, regarding any of this health stuff that we are talking about. We offer food really before anything else. And I always tell them, it's like, if you're going to go to my granny's house when I was a kid, you're going to be fed as soon as you walk in the door. A hungry stomach, they can't focus on anything else over that grumbling. We offer a listening ear when something is on their mind, because an upset mind or a hurt heart is not going to focus on hearing about rehab or other things that they need to be doing with their lives. And we think that by helping lessen or alleviate immediate problems, our clients are more open to hearing about harm reduction. So you can give them a little sandwich, or you can give them something to drink. If they come in upset and it's just something they need to talk about for 5 minutes, we talk about it. We always try to make this, and it's been said so many times, we try to make this a safe place that you can come, and you're always going to see the same people when you come. I had one of my people told me I was their best friend yesterday. And it's because we've worked so hard to try to build a safe community for them to come to us. And this is a big one. And this is something that I've tried to work when I teach other people about our syringe exchange and our harm reduction. This is the big thing that some people have a problem getting past, is what you want or think a person needs may not be what they want or they need. We need to listen to our clients and see what is important to them. And then we build a relationship that is patient-centric. And I catch myself saying this a lot, is when you come here, we are serving you. What is it that you need? What is it that we can do to help you? And we offer before the ask. That's another big one with us, because when people come in here, they tend to be nervous and worried. first off, they always think I'm like going to report them for something, or I have cops hiding down the hallway or something of that nature. And that's when I'm always like, have you about to eat? Come sit down. You look tired. Do you need Narcan today? Do you need ties? Do you like long or short needles? You know, we bring it up, kind of normalize it a little bit so they don't feel that they have to ask me for things. You know, we try to make it so that, you know, they're on the same level as us, because people who have been in, you know, addiction to drugs and stuff, they always feel like this. And it's like, nope, you need to come up here so that we can talk eye to eye. And we never put a hand out unless we're helping people up. So that's kind of our big thing here. We want them to feel comfortable and safe. And that just seems to work for us. We have people, they keep coming back. We have people, when they trust us and they feel that they want to do the next step as far as getting out of this lifestyle, they can talk to us because it's not this clinical setting. You know, we just, you know, we want to be the safe place that they can come to so that we can help them. Like I said, I had a quick one. This was last week. I had a 2-hour phone conversation with one of my folks. She was wanting out, but couldn't get out. And we were able to talk her through it and get her to a hospital so that we could get her into care. And she said, Cassie, I need help. And you're the only person that I can talk to about this. And I'm like, that's good. I'm going to stay here with you and we will figure this out together. So that's, again, that's our lessons learned that we've been doing here.
Great. Thank you so much for sharing that. Amy, I think you had some lessons learned that you wanted to share.
I think it's so funny because the common denominators for all of us tend to be the same. And I mean, you can see this on the, you know, on the form there that I wrote in. But for me, the first part of it is kind of selfish in the fact that, like, I have absolutely, it's a personal lesson that I've learned and being in this role. Like, this is exactly where I was meant to be. Like, harm reduction is my jam. I love everything about it. It makes my heart happy every single day. But to kind of echo what Cassie said, and that's truly what I wrote in this moment when I was thinking about that, is these relationships that I have been able to form through the lesson and the understanding of, we do truly meet people where they are. My thoughts and my opinions make no difference at all, and have absolutely subconsciously become back burner, because I'm here to support whatever decision that the individual I'm serving is interested in. And through that, I have been able in the last 6 months to refer 5 individuals to treatment, because I'm the obvious choice to come to. After you form those relationships with these individuals, it only makes sense that they come to me, you know, with those requests. And so fostering those relationships, getting to truly know those individuals, and being able sometimes to, like, I mean, even remember their unique identifier just when I see their face, like showing them that you're truly somebody that's invested in them, not only gives me so much joy, but you have to imagine, and as a person with lived experience, like, I know that when I encountered individuals throughout my journey while I was actively using, like, I wasn't often met with grace, love, understanding, and hey, let me wrap you up and get you fit. I mean, that is not what I was. That's not what society was to me. That's not how people treated me. And so I've said often, you know, I am them, they are me. And I treat them just as if I wish I had found that individual while I was actively using, somebody that I could have leaned on for support, and somebody that would have listened to what I said, instead of, Cassie mentioned this too, instead of always talking down to me or telling me what I needed to do, because I need people to tell me what they want to do, and I will help you get there, whatever that looks like. I mean, I've made referrals to orthopedic surgeons because they felt like when they called at the front desk staff, that they were red flagged for some reason after they had been, and, you know, everything's of course electronic medical records now, and that was in their medical chart and they were going to be able to see that. And so the lesson to me is something that we can use in every aspect of our life, is forming these loving, positive relationships with individuals, no matter where they are on their path in life, because we become the obvious choice when they need to reach out for help.
Awesome. Thank you so much. And then I think, Lauren Kathman, you had something that you wanted to say about this topic as well.
Yeah, so part of it, just kind of chime off what I was saying earlier, is just that our work that we do, it is slow and steady to get where we're trying to go. And I think everybody has known that. And I would just tell everybody, just keep informed and reach out and talk to other programs. If you're having questions or you're not sure about something, ask how they're doing something. If you can possibly implement something without recreating the wheel. There are people out there who are doing it, whether they're in other states, other programs, other jurisdictions. And there are many times I look up things and we just cold call people, or I find their email and like, hey, I heard, just even with us trying to get fentanyl test strips approved. I mean, it's been over a year that we've been trying to get this. And I just called several other counties who were doing it and said, how are you doing it? What does it look like? And some people said, well, we did, and they got pulled, and then we did this, or we're just, holding our breath, hoping no one gets mad that we're doing it. And finding out what people are doing. And I think the same thing with getting materials. So kind of one of the things, it's easy, like our internal marketing department, they're like, oh, let's brand something or get something out. And I was like, we're not really in a market of we're not selling something and making a profit off the work that we do. So I don't think that we're trying to it's okay if, Heal gives us some free marketing stuff, and then I can work with their marketing people and say, hey, can you put our colors and logo on it? And they're like, sure, we're happy to do it. Or other, health departments programs. I'm like, I love your syringe exchange flyer. And they're like, I'm like, would you be willing to send me a copy of that or PDF or one that we could edit? And I think just be willing to share stuff with each other and give stuff, because it's not, in the end, we're just getting the same messaging out to everyone that's seeing us, so it's like all users and everyone coming for help is hearing the same messaging. So don't be afraid to share stuff with each other, ask people for stuff. And it's how we've gotten where we're at. We get stuff and piggyback off. And sometimes you have a big team and staff to help you. And sometimes it's one or two people running a program. So take advantages of resources that are already out there. And then I think the same thing, just kind of like when I was talking about the police earlier, just being kind and patient when you're advocating. And I think it's easier for people who do not understand harm reduction work. It's easier for them to stigmatize and not support the work. So just finding ways to meet them where they are at, and how can you share education to them that's a way that's important to their perspective. It's not always going to be black and white. So take the small wins and keep moving forward. But one example of, I know that when our syringe exchange program started was the same county that has the restrictions for the syringes being returned 1-to-1 ratio is they were like, we don't want syringes on the street. We're tired of finding. So we had to advocate the talk about how we were going to reduce having syringes found in the community, even though we know that's not the basis of why we were doing a syringe exchange. But if you have to find what is important to that community member or that agency that you're going to try to work with, to see how are you supporting them by the work you're doing, even if it's not in the end, you're like, I was trying to go to talk about this, but if you can win them over with what's important to them, just being flexible and cater kind of how you're talking about it to who, and just be comfortable with doing that.
Thank you so much. So at this point, we are going to ask some general questions. So if people, we have so many experts here and so many people here that, are doing amazing work. So if you have specific questions for our roundtable, please feel to raise your hand, come off mute. There was one question that was sent in, and it's regarding wound care. So for the sites that provide wound care services, is this on-site or direct care, or is it referral based? I don't know if someone wants to volunteer that one.
I'll
Yeah.
say when we're in, oh, sorry.
Go ahead.
Mine's short. At the health department, our nurses will do that wound care for them. But if we're on the mobile unit, I'll take as many supplies as I'm able and educate the participant and give them as much information as I can. But we'll refer back to the health department if they're able, or Health Point, a local federally funded healthcare center here for wound care.
And then Lauren, did you want to say something?
Yeah, sure. So with our wound care nurse, specifically who's here on Wednesdays and Fridays, here at 400 East Gray Street, she's on site and she's here for the hours that we're open, and she sees folks who have any medical needs resulting or related to their injection drug use. And that's sort of her scope. If there's anything that falls outside of that, she can help navigate them, the system, and refer them to other folks, or send them to Emerge if that's necessary too. And then also she partners when we're over at 1229 Shelby Street. We have Norton's that comes in, and they have a nurse navigator, and that person works in tandem with our nurse. So if there are any outlying health issues, she helps navigate and refer them through the system as well. So a little bit of both.
Great.
We have a little similar process because we have nurses who are on site at our exchanges, and the ones that are mobile sites, they're not necessarily allowed to treat out in the community, but they can give advice and tell the participants like what they need to be doing with the wound to help. And the same thing, letting them know if they need to go to the ED or to come into the clinic and to be seen, because sometimes they can say like, hey, keep an eye on this. This is what you need to be doing. If it looks worse than this, then, or let me know next week, and then we can help get you connected to care.
I have one. So we know that all types of use, different routes of use exist along the spectrum of potential harm. I'm wondering if you could talk a little bit about your approach to discussing alternative routes of use other than IV use, and sort of what resources you provide folks who are looking for a safer way to use, and what's available and what restrictions you have towards providing those services.
I can talk to, we just have actually been talking about that a lot this past 2 weeks, kind of. So one of the things we were talking about is being able, so we were looking at articles and stuff with the increase in African-American overdose fatalities related to drug use, but that we know from the national trends that we've seen that more African-Americans are not injecting drugs, they are smoking drugs for their ingestion route. So in order to be able to offer pipes, that's not something that we would just be able to easily switch to. And we know how big of a feat it was. And then the law in the state of Kentucky requires that a syringe program offer hypodermic syringes and needles. And it's not written in there for any other routes to ingest or the drugs. And so that's something we've also been coming up on when I was kind of talking about how our team has to look up research. So like we work closely with some of the teams in Cincinnati, Ohio. We were over there yesterday because we're trying to get vending machines in our area also, but the vending machine that's over in Cincinnati is at Caracol, which is an HIV nonprofit case management organization, and their naloxone and pipes are the two largest dispensed items out of their machine. And so we brought some samples back to our office, but we know besides just saying we need to reach a more diverse population, because we think we're missing a whole big population that's not even coming to syringe exchange because they don't see us as serving their needs. Because if they smoke, then like they're not thinking, oh, I can get naloxone there, I could get tested, I could get condoms, or there might be someone to help me get access to treatment. I was like, it's just off their radar. So that's one thing with us just starting with fentanyl test strips this week, I told staff, I said, give them to every participant, but tell them, share this with your other friends who use drugs, even if they're not injecting drugs, and let them know they can come here to get those. So just at least trying to open up another avenue for some people to come to see us. But I went to our directors and stuff, and they said, yes, we agree. We just know we're not going to be able to get it passed. It's going to be a huge uphill battle. So that's we're at the beginning stages right now. I've told my staff, I'm like, let's start finding some articles and research, because I feel like we've seen stuff that, smoking is a harm reduction measure from injecting. So then you're having less wounds and less, and you're ingesting the meds slower than you would be by injecting it all at once. So we know all these things. It's just like we have to find enough literature and like stuff that we can propose and put together something to get it passed because we just know in such a conservative community that we're in, it is not going to be an easy feat. It's going to be really hard to get that. So I'd love to hear what other people are doing, but that's just where our thoughts are right now. And just kind of, I know it's what I want us to do, but you know, the fentanyl test strips, it took about a year and a half, and you know, now we're doing those. So
It's the same with us here. Like I understand, and even like safer snorting supplies, like I would love to be able to have it all. It too is going to be a really hard battle for us to fight that, likely, because I think it's going to start with, like you said, Lauren, like the education of, you know, community members and leaders and whatever, that, like you said, I mean, smoking, snorting, any type of other ingestion is obviously a harm reduction measure to injecting drugs. And so finding that and presenting that to the appropriate parties, it's absolutely on my radar, 100% of something to do. We, of course, just recently had some elections. I do think that is probably going to help, provided the channels that I'll have to get through here locally. I was hoping that Lauren Passmore, being in Louisville, I was hoping they distributed some of this and that she could tell us, because I know that in some of our smaller, more rural areas, that has not been something that we've been able to do, even though we wish we could.
So Lauren Passmore is having some screen technology issues, so I don't think she's going to be. I see her coming on and off mute. Are you able to talk, Lauren? No. All right. So hopefully maybe we can, well, you guys can get in touch and perhaps we can share that information. So I had a question, and I think this kind of touches on the law enforcement question that we had, but this is more directed at clients. So what are some of the strategies that you use to reduce fear in clients about participating in the Syringe service program? So I don't know if there's specific things you would tell them or share with them to alleviate any fears.
And we just simply say, like, all the information we get from them is kept on RedCap. It's all anonymous. We don't share that with any outside agencies. Everyone that gets or works in our booth or on the mobile unit has confidentiality training, and that we have a good relationship with law enforcement and they respect our program, but we never, share any kind of information. What's said in the booth or on the mobile unit stays there. So we're really big on HIPAA and keeping conversations to ourselves and not sharing any kind of identifying information. We would never want to jeopardize our program too. Like, it matters to them just as much as it does to us and our reputation.
Great, thank you so much. Let's see here. I had a question for Lauren Passmore as well, just her experiences in Canada versus Kentucky, but we'll have to save that for a different time. Does anybody else have any? Oh, so I got a comment about smoking supplies. So it says we would need changes in legislation in order to distribute those items in most communities, because smoking supplies would be considered paraphernalia, which would then, I believe, would be reason for search. Is that correct? And then all that kind of stuff. So
John, I would love to jump in. So I work under Lauren and asked her if I could field the smoking question. She gave me the okay.
Yeah, absolutely. Thank you so much.
Yeah. My understanding is that at one point we were closer to being able to distribute those items, but that has not come to fruition. We're pretty much in the same place as far as I understand it, that Amy and Lauren are hoping that politics change, but we recognize the need. We understand that we are missing a big group of people that are using drugs in all different forms. And we know that we're allowed to educate and say, switching methods of use can help instead of just using injection, and we can talk about that as much as we want. But when it comes to distributing safe snorting, safe smoking items, that's not something that we can do at this time. We're only focused in the use of injection equipment.
Great, thank you for following up and providing that answer. Well, everyone, we are getting close to the end of our time. We might have time for one more short question, but if I do not get one, I will go on with our announcements. But I'll leave space for a few seconds to see if anyone has a question.